Hello, my name is Ryan Kendrick and I'm a musculoskeletal physiotherapist. Today I'm going to explain some of the principles behind dynamic taping and how it differs from conventional taping methods. Dynamic tape is a highly elastic tape. The idea being that it will permit full range of movement, unlike your rigid sports tape. So we can see that it's highly elastic and stretches in both directions. This makes it very conformable, and it means that you don't limit movement in a secondary direction due to the lack of stretch. If we compare that with our rigid sports tape, which I'm sure you're all familiar with, this has no give at all in either direction. And if we compare it to a kinesio tape, we see that kinesio does have some stretch, but it has a definite end point and becomes rigid once we stretch to that point. It also only stretches lengthways. It doesn't have any stretch transversely. With a rigid tape, if we were to tape the elbow in some degree of flexion with a rigid tape, as you can imagine, all it's going to do is actually limit the ability to extend the arm. Okay, so it will stop getting into full extension. It won't ever assist flexion. What we can do with a dynamic tape, by using the elasticity, is allow full extension, but with some resistance, and actually now also assist quite strongly into flexion. So again, in some flexion, we could apply this with stretch, significant degree of stretch. In actual fact, we could continue this right up over the shoulder to assist the scapular repositioning or encourage correct scapular positioning. So now this will allow full extension and then spring back into flexion as well. Because there is some elasticity in the tape, and in this case a high degree of elasticity, it often raises questions regarding the similarity with kinesio tape. Now, as I pointed out, the kinesio has a very rigid endpoint. Now, the two tapes have been designed with very different aims in mind. The dynamic tape has been designed to be a very strongly mechanical tape. Its aim is to assist particular muscles or to use the elasticity to do some of the work so that those muscles don't have to do so much. And this may be simply assisting the hamstrings by putting it on with the knee in flexion. This will then resist the knee extension or assist that eccentric contraction of hamstrings, and then will also help to come back into flexion. Similarly, you may want to use it to encourage a particular movement, for example, external rotation of the hip during gait, and we can use the elasticity to pull the person in that direction to have that effect on their biomechanics. Now, kinesio wasn't developed primarily to be a strong mechanical tape. The aim was to have an elasticity and a thickness similar to the skin, and by doing this, when this is put on generally in a lengthened position, when the body part is then shortened, it gathers up, we get these convolutions and this lifting of the skin, which reduces interstitial fluid pressure, enhances lymphatic drainage, takes pressure off pain-sensitive structures, etc. If we do look at it as a mechanical tape or a strongly mechanical tape as we do with a dynamic tape, you see there are some important differences. So the tapes all have different aims and therefore different indications for use. The skill of the practitioner is to determine which tape to use in what situation to get the best for their patients. Now, if we take a piece of kinesio tape and we actually apply it in the inner range, so with shortening, with some stretch on it, what we will find is that that rigid endpoint is that at some point is going to limit the range of movement. Okay. I must emphasise this isn't how you use a kinesio, but I'm just trying to demonstrate the differences here. If we take a piece of dynamic tape, again, we stick it on in inner range with some strong stretch on it, what you'll find is we can still actually get all the way through the range of motion, and have a much stronger assistance, therefore, mechanically. If we wanted to use our kinesio and allow full movement, what we would have to do is apply at the end of range, like so. With a little bit of stretch. Now that will allow some, or will provide some mechanical assistance in outer range, but once we come in, the elasticity or the tension in the elasticity is gone and it's no longer providing the same elastic support as what we can achieve with the dynamic tape. Again, I must emphasise that this wasn't the major aim of using a kinesio tape. Now, there are a few important principles or tips to make sure that you get optimal adhesion with your dynamic tape. It is a heat-sensitive glue. It's important, therefore, that you give it a good rub once you've finished applying it. As with most tapes, it doesn't like creams or dirt, oils, those sorts of things. And also, it doesn't bond well to hair, so it's important to remove the hair. Generally, a set of clippers is ideal for this purpose, as you're less likely to get an irritation on the skin from using a razor, for example. It's also important to try and reduce the risk of curling or lifting or peeling of the ends by just rounding the corners. You'll find that with all of your tapes, Fixamol, Kinesio, any of those tapes, if you round the corners, you're far more likely to reduce the risk of peeling and get a longer lasting taping application. As I mentioned, the idea with the dynamic tape is to assist the muscle action. So in its simplest form, we generally apply it in a shortened position with stretch on it. So for biceps, for example, very simply, we could actually just apply in this position, run it up, also bring the shoulder into some elevation, correct that scapular position at the same time, and run it down and onto the back. When you're measuring your tape, if you measure the length that you want and back it off by around about a third, that's generally the right amount of tape to use. And because this is a strongly elastic tape, it's very important to try and reduce the risk of blistering. With any tape, if it pulls strongly on the skin for a period of time, it can cause a mechanical irritation or what we call a traction blister. The way we avoid these is by applying the ends of the tape with very little or no stretch. Okay. When you're first beginning to use the dynamic taping, I suggest you allow at least 5 or 6 centimetres without any tension on it. As you become more familiar with the tape, you'll get a better feeling of how much stretch to apply, and you can then start to reduce the size of those anchor points as well. Okay, so apply it there. It's also important not to tension and then anchor along the length of the tape, or you will end up with these tension points along there. So it's important to try and get a smooth tension all the way along and smooth down as we go along. Okay, have them again, correct their position. Now, as I mentioned, it's a heat-sensitive glue as well, so if we straighten out, give it a good scrub, you'll find that you get much better adhesion. If you get a good adhesion in the first place, you'll find that this tape lasts 5 days, no problem at all. Okay, with showering and things, that's perfectly okay. So here we're quite simply, we're using the elasticity to resist extension and then to assist flexion. Very simple. Okay. With biceps, as you'll see in one of our other videos, we can fine-tune that a little bit more to add in the supination component of your biceps muscle. But in many instances, we just need to take some load off the particular tissue for a short period of time, and that will allow things to settle down. And if we were taping this for a biceps problem, we could run a second strip up as well. Okay. Generally, we keep the strips parallel. If we want to double the amount of assistance, we have 2 strips instead of 1. Tend to limit the amount of overlapping or crossing, as the tape prefers to stick to itself, prefers to stick to skin rather than itself. If you are wanting to cross the tapes, it's useful to use one of your adhesive sprays and give that a spray on the back or on the back of the underlying strip of tape, and you'll find that the second strip will then stick to it much better.